Hi, everybody in person, and hello to all the people on Zoom. Thanks for joining us today. I am absolutely thrilled to hold this panel today, a chance to talk about how we use arts and storytelling in the scholarship of, and more importantly, the prevention of firearm injury and death, but also to serve as hopefully a little glimmer of hope in how the work of public health continues to be important. I'm honored today to welcome three dear friends and colleagues who I've known from various parts of the work, and to have them get a chance to share their stories with you. The format that we're going to use today is we're going to do about half hour, 40 minutes of us talking, and then somewhere around 15 to 20 minutes of Q&A with all of you. So put your thinking hats on, feel free to ask questions. For those on Zoom, we will be checking the chat. So let me start by introducing our three panelists. I'll do a brief introduction, and then I will let them actually introduce themselves and how they got into this work, and then we'll get into the Q&A. So directly to my left is Nelba Márquez-Greene, who many of you know. Nelba is an activist in residence here at the Yale School of Public Health, where she works to amplify and uplift the voices of survivors in the field of public health. Sitting next to her is Joe Richardson. Dr. Richardson is the M. Power Professor of African American Studies, Medical Anthropology, and Epidemiology at the University of Maryland, where he also directs their Gun Violence Prevention Center. And next to him is Chana Sacks. Dr. Sacks is a general internist in the Department of Medicine at Mass General Hospital, an assistant professor of medicine at the Harvard Medical School, and co-director of MGH's Gun Violence Prevention Center. I could go a lot longer on all of their intros, and I'm happy to do so if you want, but would rather have them talk. So I thought I'd start actually by asking, since this whole panel is about storytelling and narrative, asking you to share your stories of how you got into this work. I know all three of you have been here for a long time, long before we had centers at universities around this, but would welcome you to share however much or a little of your story you would feel comfortable sharing. And Nelba, I will start with you.
Good afternoon, everyone.
Good afternoon, everyone. My name is Nelba Márquez-Greene, and like so many of us in this space, I come to it through personal loss. My husband and I are local. I wasn't actually born here. I was born in Puerto Rico, but was raised here in Connecticut, married my high school sweetheart, and grew up in a cocoon of this American mythology that you can largely avoid gun violence if you make good choices and if you're good enough people. And it wasn't like that for us. That mythology exploded on December 14th, 2012, when my husband and I had two children at Sandy Hook Elementary School and only came out with one of them. So my husband is a faculty member at a local university. He teaches music, and he has been teaching for a very long time. I was a licensed marriage and family therapist, still am, working with families and communities impacted by trauma. And I came to understand this world of grief and trauma and gun violence a little bit differently when we became a part of the story.
Thanks, Nelba. Chana, I'll go to you next.
Nelba, thank you for sharing that. And I was a medical student at the University of Chicago, so living and working on the south side of Chicago. So I think I really thought that I understood this problem and understood the depths of this problem. And but then I was a junior resident. I had moved to Boston for my residency, and I was a junior resident working nights in the intensive care unit on that same day that Nelba mentioned. And my cousin Daniel was killed in that same shooting. And in the aftermath of that, when your grief and your experience is so public and so national and yet so personal, that tension, I came back, I was in the middle of my residency, and started reading, I started learning, I started thinking about this problem with more painful depth than I ever had before. And I was struck as, trying to over rationalize, think through this problem, read a lot the way maybe a good academic would. I was just struck with how pathetic, frankly, the literature was in this space. I was struck of delving into it and the juxtaposition of what it means to be working at an academic hospital with incredible investigators, a problem, cardiologists, hundreds of them in my hospital, literally funded with millions and millions of dollars trying to answer questions, and a deep literature trying to make life better for patients with cardiovascular disease. And the juxtaposition of that with the literature that I was reading in this space of just few papers by the same six investigators year in, year out, with just so many answerable questions that were going unanswered. And really that tension, I think, in the aftermath of what my family experienced, and recognizing that trauma and loss, I used to think of it as it's a discrete event, it happens, and then recognizing that it's anything but, was a place that I thought if I was at a place like Mass General and Harvard Medical School, if I wasn't in a position to try to do something in this space, then who was? So that's what I carry with me when I came into this work.
Thanks, Chana. Joe?
So it's interesting that during the COVID epidemic, we would constantly hear these narratives about gun violence being at its height, and it hasn't been this bad in 30 years. And that 30-year marker that they were using was actually the era that I had grown up in Philadelphia. So when we hear those narratives about cities such as New York having 2,000 homicides a year and now are down like 300, or Philadelphia had 562, where that was kind of normal during the time that I was growing up. Living in a community in Philly and seeing many of the people that I knew shot, many died fatally from a second firearm injury, and then also seeing the way that some young men self-medicated. And so I remember those times and going to the University of Virginia, and during that period, there was a television show, you can probably Google it, it's called City Under Siege. And every single day at 4 or 5 o'clock, this show was dedicated to all of the homicides in DC. You wouldn't believe that a TV show would exist right now in that space, but during that time, DC was the murder capital of the United States. And so leaving Philadelphia, going to the University of Virginia, and then watching that and realizing that every time that we were on break, I would come back to that, right? So it almost seemed like Philly was a point of reality for me from what was happening to me at the University of Virginia. And so that really started my journey, knowing that sometimes you have survivor's remorse because many of my friends are no longer here. And I started working on a study as a doctoral student, looking at the social context of adolescent violence in New York City. I followed 25 kids for 3 years from one 7th grade class. And I had 15 boys and 10 girls, and I spent every day in school, out of school, as basketball coach, trying to understand what would lead to violence among these kids for 3 years. And during those periods of time, I always felt I wish people could see and hear what I'm seeing, and just be a fly on the wall, because I had the most compelling, interesting conversations sometimes with 13-year-old kids who, if I closed my eyes at that time, you would think that this kid was 25, because that's how accelerated in terms of the experiences they had in that time. During that time, they were living like many adults, but still with child bodies. And I clearly understood the way that we adultify Black children from that. And then the last thing I'll say, I was watching CNN one night, and there was a show led by Soledad O'Brien on Black in America. And one of the segments was on Carnell Cooper, who's a trauma surgeon and also started one of the first hospital violence intervention programs in the country. And I'm watching this show, and I've already been firmly established as a violence researcher, but I was fascinated that there was a program that actually operated in a hospital setting to prevent people from coming back for a repeat violent injury. And so the next day I cold called him, and he invited, I said, I saw you last night on CNN. I know he's like, who is this guy? He's like, I saw you last night on CNN. I was wondering if I could come to your shop. He invited me. 2 days later, I go to a meeting. As soon as I arrive, the Discovery Channel's there. He was very popular. And so I had to sign a release form, and I was on television. So I knew that this was going to be the person I should connect with. And from that point, that kind of started, the road into hospital violence intervention programs and doing the work that I do in the CVI space.
Thank you. Thank you, all three of you, for your vulnerability and sharing your stories to start us off. And I think that serves as a great segue into really the point of this panel, which is how we bring humanism and stories into the academic work. The four of us have spent a lot of time talking together, as well as each of us individually, about the reasons why and the ways in which we bring narrative and stories into the academic quest for data and for answers. I don't need to tell all of you in the audience, but there's a lot of tensions in doing that, right? The academy doesn't always recognize stories as being the same kind of level of rigor as quantitative data. There's also gaps between what gets funded in the ways in which we pursue this work. So I'm interested in hearing a little bit about, again, from the story aspect, how each of you have pursued that melding of humanism and data, how you thought about kind of as you've emerged into this area of work, how have you bridged humanism and the quest for answers? And you may want to share some of the projects that you're working on, or you may want to share some philosophical thoughts. Either are fine. I'll let whichever one of you wants, maybe I'll go in opposite order because it started with you last time. So maybe Joe will go you and then Chana and then back to Nelba.
So in 2019, my colleague and I, we were awarded a grant through the Center for Victims Research, which was only $15,000. I want you to remember that number, to do a digital storytelling project. And we decided to do it on 10 young Black men who we were working with in our trauma unit through our HVIP. And when we finished the interviewing the 10, fortunately, we still had money left over. And our grant administrator basically told us we didn't have to spend it. We had to spend it. So we decided to open the scope of everyone who was involved in that space, whether it's trauma surgeon, violence interrupter, district attorney, people from the clergy. And I felt at that time when we were hearing those narratives and knowing what was being portrayed in the media, that people weren't seeing the humanistic side of the young men that we worked with. Because when we decided to do the film, unlike many films that I've seen in documentaries, which kind of fuel and perpetuate the stereotypes among Black men, we really wanted to show the vulnerability of Black men that we were hearing in our interviews. And so when a young man was speaking about not just the traumatic stress tied to the event, because I think often we focus on the event, but the continuum of traumatic stress from childhood. So when we would begin to pull back the layers, we would hear stories about adverse childhood experiences. And that was a narrative that was, to my knowledge, I had never heard that narrative before in terms of how we frame the lives of Black men. And as we were discussing before we started, the media does a terrible, horrible job in its portrayal of Black men in terms of gun violence. And that narrative needs to change. And so we really were committed to gathering those stories. But I think as a scientist, one of the things that I kept at the forefront was we also need to layer this with data, because I didn't want it just to be about stories. So if If we needed to show, for example, in Washington, D.C., in one neighborhood, Woodley Park, the life, which is white, predominantly white, middle to upper middle class, life expectancy is 89. If you travel 20 minutes to Ward 8, to Congress Heights, where it's predominantly black and low income, the life expectancy is 68. We need to convey that. Like, how do you get to that point? In the same city, in the nation's capital, in a 20-minute ride, you lose roughly 21 years of life expectancy, right? That's just not an issue that focuses on gun violence. That's with every social determinant of health that we've arrived at that number. And I thought it was just really important to show how young black men live in that context, how they still are human, vulnerable human beings with feelings. They're not robots. They're not super predators. And as a black man, I think it was also critically important for me to show that narrative and the complexity of us, and how that could be those narratives could be supported by data.
Thank you. And I love how honestly, just to kind of say out loud, Joe has created his career around this and has really pioneered the use of digital narrative to illustrate the stories and then use that to drive folks' attention to the data. And so kudos to you for making it possible for so many others after you. Chana, how about you? You've taken a little bit of a different approach in kind of how you think about the science and the stories intersecting. Do you mind sharing?
Yeah, absolutely. Just so inspiring to hear that and to think of all the ways different paths lead to the same place if you feel like you're doing this work right. So thank you for sharing that. I started a Center for Gun Violence Prevention at Mass General Hospital, and I can do that and got support to do that. And I can land myself on the Boston Globe, Harvard Medical School, Mass General Hospital are doing this. And recognizing from before I even started that I can do that. And the people who are on the front lines of this issue in communities in Boston, which is Dorchester and Roxbury and Mattapan and communities, predominantly communities of color, who have been on the front lines of this issue for decades, doing the work, being survivors, working with survivors, working on healing in communities because of all the ways that the hospital has let them down, on the front lines and not getting in even a fraction of that coverage. So really the ethos of our entire program was thinking about how do you start an academic research program that not only never loses sight of that, but not as an afterthought, but having those most affected by this problem be at the center of determining the questions that we're asking and what we're framing in order to be doing this research right. And so we did that. We were listening to survivors. I was in a good week. I'm in community organizations and in youth coalition meetings more than I'm in my research office. And a few things. One is time and time again, what we were hearing is exactly what you just heard, which is the media is only showing up. Reporters are only showing up in our part of the city on our worst days. If it bleeds, it leads. They're telling stories of who shot whom with only telling those stories. Sensational headlines with no in-depth reporting. No follow-up of how people ended up on both sides of the gun. No follow-up of what resources people needed to build in the community because they were absent, and families who had loved ones died were leaving the hospital, not just figuratively empty-handed, but literally empty-handed with no knowledge of what came next and how to go about planning a funeral. Just the bare basics that we could do as a healthcare system that we were just failing so miserably at. And, I like to think that I have some creative skill sets, but time and time again, I'm hearing we need narrative change. We need to change media and change journalism. And I was pretty aware that I was up against my skill set. I'm trained as a physician. I was trained in public health, but that wasn't what I was trained in. But the incredible part of doing this work, doing any work in the communities and the academic communities that we're all in, whether it's here at Yale or at a place like Harvard, or in a place like Boston, is that those resources are there if we know how to break down some of these silos. So walked across a mile from my office is Emerson College, which is one of the world's leading media arts journalism schools, and went over there with one of our community partners who we were doing some of this work with. And I walked in, as an investigator, you're trained, you better ask a very specific question. The answer better be interesting, whichever way it comes out. It can't just be if one way is interesting and kind of where you're headed. This was the exact opposite of that. I walked over there and said, this is the problem that we're hearing. Who needs to be at this table? And I have no idea where it's going to go, but what does that even look like? And what that turned into is now we're in year 3 of this partnership where every semester at Emerson College, there's 2 to 3 courses going on at a time dedicated to the issue of transforming narratives of gun violence, where each class is in partnership with a community organization, not somebody who's popping in to give one 40-minute lecture and then returning at the end of the semester. I mean survivors, people who are living and breathing this every day, who are in these classes. They are taking and teaching these classes side by side with students and faculty. So all of a sudden we have a hospital, we have another university, and we have community all literally in the classroom together hours a week doing this work and creating documentary films, creating immersive media and VR programs, creating music videos, creating theater productions. I mean, the work has been incredible. And I want to give like one specific example. One of these courses created a 19-minute documentary called Quiet Rooms, which starts in our hospital in that sterile room. I don't know how many people have been, can picture this, but often in our emergency department, in kind of one of these hospital rooms where we call it the quiet family room or different names, where we deliver as doctors bad news, sometimes the worst news to families, and way too often that their loved one died from gun violence and we couldn't save them. And in that room, which honestly I've given passing thought to the space, every single survivor that was part of this class talked about their story of how horrible that physical space was, how sterile that room was, how cold, how isolating. Everyone. And this 19-minute documentary you can't watch without understanding how we need to bridge this gap in a different way, understanding what resources community had to build because we in the hospital didn't offer them. And the beautiful part about some of this work is that it empowers everybody to these survivors who are coming and talking on panels about their work. I'm thinking of Carla right now. She is a film producer. She calls herself a film producer now. And she tells us that she learned how to tell her story in a way that felt authentic and that felt real, that it was her story. And then it empowered people to say, how can we do better? Great, you made this 19-minute film. Can we fix these spaces? Like, this is a solvable problem. It's a problem I never would have thought that needed to be solved. And literally 3 weeks ago, we had survivors, we had community members in our hospital emergency department picking out paint swatches. A group was creating this entire mural that's now going to be the wall of this one room off the emergency department. And room by room, we're making a change in our physical hospital space because that's what our community partners told us that we need. So it's just one example of how do we take those stories, how do we understand those and really affect real change. And then how do we understand that all of those people, all of those survivors that are working with, that are becoming part of our academic partners and our research families and collaborators, realizing that they don't show up on a stat sheet anywhere. That the way we talk about gun violence in this country, we measure the number of deaths. I can tell you with incredible precision how many people die from gun violence each year in this country. But how many people were shot and survived? I can't even tell you that number with real precision. How many people loved those people? How many people every day whose lives are different because of what happened? We haven't even bothered to count. And those questions directly shape our just straight up epi research. Those questions, those conversations is what shaped our work to look at big insurance health claims and how do we link family members and understand when when an adolescent dies from gun violence, what's the effect on their family members? We learned that when an adolescent dies from gun violence, their mothers, their siblings get less routine health care in the years after. Just at that time where we need to be wrapping resources and everything we can around that family, that's the moment they're falling out of care. Wouldn't have known to ask those questions had I not been part of those conversations. And it directly leads to the interventions that I think have a chance of helping make change.
Thank you, Chana. It's an incredibly powerful example. And I'm appreciative, and having sat in that quiet room on both sides, I'm grateful for the work that you're doing. Nelba, I'm going to turn to you with a slightly different version of the question, which is, I got to know you actually through your storytelling and through your insistence on the value of the story, but also the insistence on the respect for the people whose stories are being told. And I wondered if you would mind sharing a little bit about kind of the motivation for that, and if you're comfortable, kind of how you've kind of walked that walk over the last decade, and then how it's led to what you're doing now.
So I remember before, so we'd only moved to, this is important context. We were not from Newtown. We'd only moved to Newtown 4 months before. We were from a different community. And before we signed up to get our pictures taken, and I signed a form that said that the photographer, once she gave us the photos, could not further use those pictures in anything else. What do you call that? A consent form? Yeah. A release form? Those forms don't apply when you lose a person to gun violence. When you lose a person to gun violence, the use of their memory and their story, the stories you tell or who they were, it gets taken from you. We have no way to protect the treasure we hold dear and what's left of them. Dr. Richardson was talking about we fail to see the humanity in Black men. That's how I felt as well with my daughter. I became a tool for activism that had to disembody from humanity in order to survive. That's what the experience felt like to me, that both activism and academia needed the story in order to find funding, in order to make compelling arguments. But I no longer had rights to what was told of her, to what was remembered of her. And that, as a mom and as a human, just hurt me deeply. We were still a family. I still feel like Anna's mother. So I started writing. I started telling compelling stories about her. And people started following. And I started teaching people how to be more respectful of survivors, how to understand that there was no entitlement to these stories, and how to better use them in order to create change. So that includes being respectful of making that demand, right? We're actually not, we have created an environment for survivors that we feel entitled to what does not belong to us. Case in point, how many articles have you read that have said, time to release the images? If there's one question that bothers me more than any else as a survivor, someone who has lost a child to gun violence, is why would you not share the images of her body? Because those pictures belong to me. And if you think for a minute, I believe I live in a nation where sharing that publicly would make change, we're delusional, right? And there's no data to back it up. So it is the powerful use of story. It is the integration of data so that we can better learn not only how to do gun violence prevention before it happens, but also how to better care for people. Because what I focused on was coalition building. I talked to mothers, I talked to dads, I talked to siblings. I have spent about 10 years talking to people, and they want resources to match the demands that we ask of them. They want to be heard. They want to feel like their loved one is remembered. They want to feel useful. They want to be paid. They want infrastructure. They want more than what we have offered to them. And I have to say that losing Anna is the most painful experience for our whole family, but also the extractive, exploitive relationship that we have with survivors of gun violence, which I often say are a unique set of individuals who sit at the intersection of grief, trauma, and injustice. I have to say that is a continuous, everyday pain every moment I wake up. I have to constantly look and say, what is being asked of me, and am I being resourced to do the work? And that is a question that I feel, and I think that's a question that many families who have experienced gun violence absolutely also feel. Did I answer the question right?
Yeah.
Okay.
Thank you. There's no right or wrong. So you did awesome. Thank you. I'm going to turn from that your powerful statement, which I frequently quote around that intersection between grief, trauma, and injustice, to talk about one of the things that you've both alluded to as well, which is the way in which the stories help to illuminate some paradoxes and potential solutions that may not be part of the orthodoxy. So one of the things that all of you in the room, right, think about is we think about how can we create solutions. Those of us that are tenure track professors think about how do we do it in a way that is novel and is going to get us kind of our next paper, our next grant, or kind of, right? That's a part of the thought process. But hopefully we're all here because we want to help create change in the world. But we also all come with ideologies, lived experiences, stuff that we learned, and assumptions about the process and about what people need in order to heal. I think that's true regardless of the issue that we work on, right? Today we're talking about gun violence, but it's true when we talk about cancer survivorship. It's true when we talk about exposure to environmental contaminants as well. I could go on. One of the things that I think that all of us have shared is this kind of process of bridging paradoxes and also the exclusion of some voices over others. You've talked a little bit about it, but I'd love to hear about ways in which you're listening. You've said a little bit of it with a quiet room, but ways in which you're listening has kind of maybe illuminated new or different paths forward as we think about the either prevention of gun violence or healing, primary, secondary, tertiary, stopping it before it starts, stopping it from coming back, or helping to heal after exposure.
Yeah, absolutely. And, I shared a little, which is how listening to survivors, centering those who are most affected leads you in all of these different pathways. And I think that is a truly critical piece. And I think listening shares every one of us has blind spots in the work that we do. But when we listen, we start to uncover them. That's not inevitable. We're not helpless in that. We can actually learn those pieces. In one of our meetings, a woman, Clementina Sherry, who runs the Louis D. Brown Peace Institute in Dorchester, who has been a teacher to me and to so many people, whose son Louis was killed almost 30 years ago. And she started the Mother's Day Walk for Peace. Anybody who wants to join us Mother's Day this year, any year, is one of the most beautiful events in Boston every year. And one of the years we were sitting in the hospital, and one of my first meetings with her was right before Mother's Day. It was 3 weeks before Mother's Day. And another hospital in the city often kind of sponsors that, and we'd never been approached. Mass General had never been approached to come join it. And I said, why is that? She goes, never occurred to us that Mass General would be interested. It's like, oh, that's all you need to hear. It was like 2 weeks away. We scraped together a team of I think probably 9 of us that first year, raised $1,000, and we marched. And now over the last 6 years, we have a team of dozens and dozens of people who show up. We're the leading fundraiser every single year now. We start these wild competitions of all the hospitals in a joyful competition against each other of how we can be there and how we can show up and how we can be present. And so often it starts with not asking a single thing. It's showing up and being present. And when I asked Clementina one of the first times, I said, how can we support you? How can we help? Expecting kind of the usual stuff, which is this problem is so big, nobody knows where to start. She looked at me and said, we've developed a burial guide that you could have in your hospital. Literally the silence. I wasn't used to concrete answers to what can we actually do here. But guess what? If you ask that question of people who have been thinking about this nonstop, they have concrete solutions of what could make their lives and theirs in their community better. And it's yeah, we can do that. We can help not only help that distribute that guide. We can help raise funding for it. We can help support it. We can disseminate it. We can translate into other languages. There's so much more we can do. And I think there is so much learned helplessness when it comes to this issue in this country. Yes, this issue is big. Yes, this issue is multifaceted. Yes, this issue is complicated. Yes, there's the politics and all of these things swirling around it, but we can't let that be an excuse for inaction. And so often that learned helplessness, the best way to reject that is to be useful to people who can tell you how to take kind of that first step. And that first step years ago, sitting around that table of didn't occur to us that you'd want to show up, has really developed into this unbelievable partnership where we're trying to flip, as Nell was talking about, that exploitative, extractive model. I think we can do even better than just stop being exploitative. We can flip that extractive model on its head. I think I have chosen a career in academia because I think it's an unbelievable place to try to affect change. And I think we have a lot that we can offer if we start extracting some of the best of academia to leverage and advance for the communities where we live and work. So I think it's not just stopping exploitative. It's how do we think about leveraging what we have to offer, whether it's film schools at a journal at an arts college, whether it's the resources that we have in our hospital-based programs to bridge these gaps.
Thank you, Chana. Joe, and I'm actually going to call on something that we were talking before about gun ownership and where you live and kind of some of the, yeah. Do you mind talking about that and what you've learned by listening there?
You want me to answer both?
I do whatever.
Okay.
I'm changing the question. I'm throwing you something different.
All right. With the gun ownership. Yeah. Okay. I own 2 guns. I live in, I'm from Philadelphia, as I said, but I live in a very rural county. And it's interesting when I hear gunshots in my county because I know that people are actually using guns for recreational purposes. So it's normal to hear on a Saturday morning, maybe 100 yards away, someone shooting their gun and they're engaged in target practice, in their on their land because people have a lot of land, right? So, but if I were to travel to where I do my work in D.C. and I would hear the same sounds, that would automatically trigger my own trauma, right? Regarding what I think potentially could be happening when I'm hearing those gunshots. And so I think one issue is around guns, and it has always been the case since the very inception of this nation, is the stripping of firearms from African Americans and the violation of African Americans' Second Amendment rights. And so in one way, we're in academia, so I've worked with people who shun the use or owning a gun, but never really acknowledging what that gun actually meant in terms of being an African American in this country, right? We've had slave patrols, which then transformed into the contemporary gun trace task force, which we've had in Baltimore, gun recovery unit in Washington, D.C., the Scorpion unit in Memphis, which killed Tyree Nichols. I can go on and on about the ways that we've used interdiction efforts in cities and predominantly black communities to retrieve guns without that war being waged, analogous to what we saw with the war on drugs. Yeah. And I tell my students all the time, I said, you will never find a DEA running up into dorm rooms here, even though I know you can get drugs at any time of the day on this campus, right? That's not going to happen, right? And we know, I was a college student, so I understand, but I know the privilege that comes with that. And I think people don't understand when that war is only being waged in one community and we know from a data standpoint who actually owns the guns, then clearly we're engaging in structural violence and institutional structural racism. And so it's just an important point. I think we need to acknowledge that we're actually encouraging, and I encourage young people, if you want a gun, legally own one. Go to a range, learn how to shoot, right? If you really want to be a responsible owner, learn how to store your gun. Yeah. Right? Those are really important pieces. I will say one thing quickly to your first question that you asked regarding listening. Please. Sometimes it's not always about what they said. It's about what they didn't say. And in digital storytelling, I think one of the most important and valuable pieces of doing the work is that you're capturing the body language of what someone didn't say. They didn't say it verbally. But there have been so many pregnant pauses that I've realized during the transcription process that I'm so glad I didn't say one word. Because sometimes you just need to have an awkward silence and give the person the right and privilege because they own the story to tell it without me forcing my question. Yeah. And I hear interviewers so often not give people the respect and dignity and space to answer questions in the way that they see fit. If you want to take 2 minutes, 3 minutes, 5 minutes, 10 minutes, you don't want to answer at all. It's your right. And so we really need to engage in the process of listening and respecting people's rights and values and supporting their dignity, because I've been in situations where we have filmed someone and they've come back to us. We're in the middle of production, and they've come back to us and have said, I need to be taken out of the film. I'm hot in the street. And I don't know how many of you have produced a digital story. It takes a lot of time and effort once you have this person weaved into your narrative, and they may be a focal character, and now they're involved in something which may jeopardize their lives. And you have to respect that. Mm-hmm. So that means going back through the entire project and deconstructing it to remove their voice, because you need to respect that. And I think that's also like a critical piece of just listening.
Thank you. Nelba.
You talked about humanization, and I'll just say that I think my voice is loud enough to get but what we humanize is directly tied to what we value. And what we value in a society is directly tied to the isms that it holds dear. And we are really living in a moment that highlights that we have a lot of isms we need to work through. And I think this value question is important because Newtown should not have been the moment that so many stories came up. We had gun violence long before Newtown. We just never valued the story because of racism, because of patriarchy, because of so many other things. There have been mothers in Connecticut working in gun violence groups that they started 30 years ago that didn't get any funding until Newtown happened, right? And it's something we should pay attention to. So how do we successfully integrate? We successfully integrate by being in community with people. We should not have the expectation that we successfully integrate anyone into our work we are not in community with, we are not investing in, we are not trying to spend time and money and doing all of the listening we need to do. So I am really proud to be here because I think we should be using all the resources of the university to invest back into community, specifically New Haven and communities outside of it. When we're talking about gun violence, having a community advisory board, having many, many different ways to intersect with community here at Yale. So I plan to Robin Hood all of the resources of Yale for the community to the best of my ability for the time I'm allowed. Dean Ranney, that was my goal. I'm telling you now, I'm confessing. But it's not because of, it's because we have intentionally uninvested for so long, right? We have to put the money and the resources and all of our care back. The core function of dehumanization is to deny pain, and we have denied the pain of gun violence survivors for far too long. And it's time. It's time we do this differently and better. And I think we can do it differently and better at Yale.
Well, thank you. I appreciate your faith. I'm there with you. So I have like 2 more questions that I wanted to get to, but I also recognize time, and you all probably have a lot more questions than I still do. So I'm going to open up to the audience. And while we do that, I feel like I need to acknowledge that we've talked a lot about some forms of firearm injury and death today, but not at all about one, which is that we've not talked about firearm suicide, which I know that we've all had experiences with, and which of course is the most common cause of firearm death in this country. So I just want to kind of say that as we are talking about stories, acknowledging that there are some very important stories that we're not sharing today. So, which is not, it is what it is, and you can't get to everything in 45 minutes, but that's also why this work matters and why we're going to keep doing it for a long time. So you've been waiting. You've been sitting on your hands waiting for me to open it up, Judy.
Well, thank you for all of this amazing work and sharing of personal stories. There's a lot of talk about listening and telling stories, and how sometimes what has been told can be used or exploited. And so My question is, if we want to do this well and do it better, how do we build trust? How do we build the environment where it's okay to share the stories and know that they can be safeguarded?
Who wants to take it? Nelba's ready.
I'm giving you one opinion, one slice from right now. But I think it involves a lot of different steps, including being incredibly clear with what that process and product is. All too often, we're not giving the information, nor are we respecting the participant time through, like, what are they getting from this project that we think is great, but it's actually costing them, getting to your place and giving their story. And we often tell them it's great because, but it may or may not have value to them. So I would start it with first asking, what is valuable to you? What is it that you need? And then developing my project to the best of my ability around that, elevating and answering the questions to those needs. So that's just one thing I'm thinking about, in addition to, a commitment to shared goals and outcomes, commitment to listening, clear roles and responsibilities. I'd written a bunch of stuff down, but I hope that's a good start.
And maybe I'll build on that and maybe what we're trying to work on in our program is real co-creation. So it's not that it's an interviewer and a participant, but it's all of those individuals coming together to decide what story they want to tell, so that the person who is the survivor, that in the more typical extractive model would be the person being interviewed, and then they get to see how it turned out and, like it or not, actually is the co-creator of what is being told. And they come out of that being the producer of it, that is then proud to go share that piece, then is leading that effort. And we've ended up in a lot of discussions in journalism schools around the city, around the country, with is it okay to call people partners instead? In traditional journalism, it's the source. It's like, what about the word partner? We've ended up in a lot of details there that are a lot more than semantic to get at your question of really creating a co-creative process. And to Nelba's critical point of making sure people get things out of it, we started right now, any survivor, any community members who join these classes have a choice of stipend and funding or getting college credit for joining. And that became out of the discussion of what would be useful, what would be needed, and what would be valued by people who are joining in this co-creative process.
I would say having your community partners directly involved, as mentioned, as producers, as executive producers. My community partner was actually part of my HVIP staff, ended up starting his own CBO and working directly with the young men that were impacted. And so he was also someone who was injured. But I also, one of the things that we were remiss not to discuss, and I know was part of our questions, is in terms, and I'll cover it since we didn't cover it in the questions, is just around intellectual property, right? Mm-hmm. And I can tell you a horror story. When we first started this process, we completed the film. We had it on the website. People were viewing it. We had tons of rave reviews, and we decided, well, we should put it on a paywall. Yeah. That was probably a bad idea. So we got a attorney and an entertainment attorney who then looked over our intellectual policy for our university and came back to me several days later and said, listen, I have some bad news. I was like, what is it? What could possibly be bad about what we're doing? He said, you don't own any of it. Mm-hmm. Which means your community partner doesn't own it either. And that was one of the worst days in my career, to go to my community partner, who I've been working with for almost 2 to 3 years on this project, and tell him that the community doesn't own any of it. Because I was not clear on what the intellectual policy and ownership of everything that we created is. We need to get that very clear when we're doing and engaging in this work. And so for the gun violence initiative that I lead at the University of Maryland, we started a series of discussions this year called Dialogues in Design Justice. And we have the community come in and we discuss everything honestly, put it on the table. What harm has the university done to you? And that could even be through benign neglect, just not even showing up in the communities. How can we get to a point of restorative justice, truth, and reconciliation between the damage that the university has done to these communities, right? But how can we structure MOUs that benefit the community, not the university? And so, as Nelba mentioned, just extracting and using all the university's resources as in a form, in many respects, a form of reparation, right, for all the damage that we have done to the universities for the benefit of us, right? And so I think that's like a critically important part of this piece is if we leave with anything today, it's the memorandums of understanding of ownership, because the community has walked away for decades without owning any of the data, any of the projects. Their names are not on anything, and they have not benefited at all.
Yeah. I'm going to add one more thing to the list that I know that the three of us talked about, or the four of us talked about before. I keep looking at the three of you and saying the three of us and leaving myself out. So, which is the sustainability factor. And you talked about how you've kind of broken down silos in the work that you do to make sure that the work continues even if one group pulls out. And so kind of that being one model for creating trust is working across multiple institutions and organizations so that it can stay in place. And something, Nelba, that I know that you talk about a lot as well is that kind of sense of we show up and then we disappear, and that is a huge barrier to trust. I think we probably have time for 2 more questions. Okay. And then I'm going to have us close with a little bit of just hope and why we're still hopeful even in this moment. So that's going to be my parting thought for us, just to warn y'all. Go ahead.
Hi, you all. Thank you for this panel. My name is Joy. I'm a first-year PhD student in social and behavioral sciences here. My question is around using storytelling, not just for healing, but also as it relates to restorative justice. So in 2013, I lost my younger sister to gun violence, and I remember being at the trial of the young man who took her life. And in the journey of me and my family, and also his journey, there was a sharing of stories. There was a me writing to him and him writing back to me. And there was a realization that we weren't just a victim, but he was also a victim of a lot of things, coming from where we came from. And so I'm wondering if you all have thoughts or in terms of narrative and storytelling as it relates not just to community healing, but also some of the other injustices that lead to gun violence.
Thank you, Joy. Your therapist perspective?
I can tell you that it can be a very useful model for survivors. I can tell you I know other survivors who have participated in that. One of the survivors on Shared Humanity, the podcast that I do, just talked about doing the same thing with the person who sold the firearm to the person who killed her parents, and how they began a communication. So I know that the best use of the storytelling is for whatever gives meaning to you, and it sounds like this was very meaningful for you and for that person as well. So it is certainly another angle that we can take.
And first, thank you for sharing that.
I'm so
deeply sorry for your loss. And I think as Nelba just said so spot on, that there's not going to be a one size fits all answer. That we know people who do restorative justice and think it's and engage in those structured programs and think it's incredible, and some people who think it's not the way forward or don't feel like it's right or in a position. But I think what you're really getting at is a critical part of the reframing that's needed in transforming this narrative, that it's good versus bad, and that these stories of how people ended up on both sides of the gun, that it can be the same experiences that are a risk for ending up in either place. And one of the courses that recently happened that in our program had somebody who lost their son, and somebody who was the mother of the person who ended up being convicted of that killing together in a classroom. Something that was, let me tell you, is certainly not right for everybody, but was a choice of those individuals to come together in that. And the experience and the that unfolded was really striking, and I think led by those survivors.
I think we'll do one more question, and yeah.
Thank you.
Thank you,
I have a
Olivia.
very practical question. How do you go about garnering funding to use arts to tell stories, right, for a public health related topic? Because my guess is it's not through traditional public health mechanisms.
I'm trying to fundraise for that right now, so stay tuned. But yeah.
I'll start with saying one of my turning points in this field in general was, I've been in this field for 10 years. We can count the exact days and months. And as a junior person at the start of my career, mentor after mentor person would be like, that's a risky career path, right? There's not a lot of funding. People have heard of the quote Dickey Amendment. There's not a lot of NIH funding or CDC funding at the time, so you can't really do it. And one of the things that was really striking to me, and one of the turning points for me in this space, was people always talked about this federal ban on funding as the reason that we couldn't do the work, and whether it's a real ban or not, a conversation for another day. But I pulled CDC's budget in the year before this supposed ban went into place. So at the quote heyday of gun violence prevention research funding that I've been told was the reason we couldn't do this work is because we got to get back to that space. It was something like $2.3 million. I'm a doctor at Mass General. We spent that money on an MRI machine, on any given Tuesday in the hospital, which all of a sudden said that can't be the excuse for inaction here, which led me down a path of, okay, what if we stop, great, we'll keep fighting for federal funding, and we have, and maybe we will again. But what if we just go out and raise half that amount of money and get to work? And I share that because that really started us down a different path of thinking about different funders and different foundations that have invested in this work and different individuals. And how do you think creatively about different foundations or nonprofits or angles on this work that people wouldn't necessarily think are related? As Dr. Ranney pointed out, we haven't talked about firearm suicide much, but there are suicide prevention orgs that might fund some of this work in that space. But even though they didn't know that they were interested in the space, but you can go pitch that maybe they would be. So it's really thinking about all the different people who are in this space and foundations and others, thinking about the fundraising, which is, it's great that there are deans out there fundraising on behalf of these things that can help support it. And it's trying to be really creative about the work that we do, and having a really protected ego when you write grants, right? I tell myself all the time that, like in baseball, if you're hitting 3 out of 10, you're doing great. So I keep that in mind a lot. So well-protected ego and creativity are maybe my two.
Joe, you got lots of thoughts about this.
Tons. I would definitely say tapping into other philanthropic initiatives outside of the federal government. Because even if you may try to build that into your proposal, I have experienced the digital storytelling component being extracted from they would fund every other aspect of the proposal with the exception of that. And so the onus is for us to also within the academy to make compelling reasons why digital storytelling is rigorous. It's a rigorous method that we should be using and we should be uplifting. And so I would definitely encourage you to look for alternatives outside of the usual suspects, but also which we haven't touched on are what are private donors interested in? There are many people out here who have experienced gun violence, whether directly or indirectly, that would like to donate to projects, right? And so establishing your connections with developing donors who are interested, for example, with our project in Baltimore, we hired a person to directly reach out to donors to support the work. And so I think once people see it, how tangible and powerful it is, they're more likely to buy into it. And you also can show your return on investment. I think, the same way in the movie industry. You can make a $20,000 film, and the next thing you know, 20,000 people have seen it, right? So we can't ignore that there's also an economic component to all of this, right? And so I would just encourage you to look outside of the typical government agencies, private philanthropy, donors, and if you don't get that, you can shoot a film, and I don't mean to. I hate to use the term shoot, but you can create a pretty decent film on your phone, which there have been award-winning documentaries that are created on iPhones, and so you don't need a ton of money. You just need the will to go and do it.
There's a rhythm of reimbursement we have to chase in order to keep the lights on, and that's true. But there's also a rhythm of healing that I do think there are people who want to support, because even if we ended gun violence today at 6 p.m., 2 hours from now, there are millions of survivors in this nation that would still need support. And we're not producing enough therapists, enough support systems in order to treat them all. So finding ways of healing, and if, digital storytelling or other community-based ways works, and I think there are people who are invested in that as well, specifically private folks.
And there I'll say, please do not hire someone to go and get donations on your own. Talk to me and to our development professionals. I can't speak for what they do at Maryland. Here, that would not fly super well with the university, but we will happily work with you in terms of creating relationships with foundations and individuals. So that will be my plea on that part. But I don't disagree. All right, we're a little bit over, so I'm going to real quick. This is a moment where I'm going to recognize that a lot of us in the public health community are feeling a little bit discomfited. And I've heard a lot over the last couple of days. Oh, now all the work that you're doing is going to have to stop. To your point about kind of where we started, can you tell me why you have hope for why we're going to keep doing better? Any of you? We'll do it like 2 cents.
Real quickly, yeah. I was doing a site visit the other day at a CVI. When I say CVI, Community Violence Intervention site that does street outreach. And we presented our research study to the site. And when the meeting was over, one of the young men approached me and said to me, "You're Dr. Richardson. You're the guy who created Life After the Gunshot." Totally unexpected. And he said to me, "That film is the reason why I'm here doing this work." So that's all I needed to hear in terms of impact, that this film encouraged someone to engage in violence intervention work and the impact that the film had on their lives. So if we can spread that around, then I think the job is well done.
One of the reasons I'm most hopeful is because those of us in this space, we were a resilient group because we've had to be. When some of those traditional funding mechanisms, everything you're getting at isn't there, when the work is heavy day in and day out, the way that we've made that sustainable is because we've developed incredible communities that are there for each other and really center how we take care of each other and ourselves as we do this work and we advance it. And I think that sets us up to stay focused. Not a single thing that we talked about today, other than maybe a few hints at some of the EPI projects that we got to. Almost not a single thing that we talked about today is dependent. We didn't ask federal permission for any of it. We don't intend to start tomorrow, regardless of what happens there. It's all work that I think is needed more than ever, and that we envision continuing and will be driven to. And nothing that happened this week is going to change that for me.
I think what gives me hope is the strength of the survivor community, the strength, the courage, the resourcing now, the demand, the pushing back and asking for what is needed, not just to survive, but to thrive. I am seeing incredible acts of courage and bravery. I think the movement has been stripped bare of celebrities, and it is now time to do the work at a very grassroots level. And there are brilliant, brilliant students in the building here at Yale, voicing that, working in that, and around the country, researchers and people who are doing incredible work. And that gives me hope, and not just strictly in gun violence prevention, but in the many issues that intersect, whether that is, disease or homelessness or the many issues that intersect with gun violence as well. And I just want to thank you, all of you, for taking the time this week and today to come to something like this in a moment in history where I think many of us, it's safe to say, we are stripped bare. The idea that so many of you would come out to listen to this particular topic when you could choose not to means a great deal to me. And I just want to point out that our hospital violence intervention program partners are here, who do the work every day at Yale, in the emergency room of responding to. Also, if you're unfamiliar in New Haven, there are two things I want you to know. There's the Botanical Garden of Healing, which is dedicated to victims of gun violence in New Haven, which their stories have often been neglected, again, because there's a reason. There's a reason we have this cry, Black Lives Matter, right? Because they traditionally have not to us. So please, Botanical Garden of Healing, visit that, learn about it. It was started by mothers. And I forgot the second thing I was going to say. Darn it, I was on a roll.
Listen to your podcast.
No, I'm not going to make a plea for me. I'm not going to make a plea for me. Dr. Richardson.
I'm going to say we have a QR code up here. So if you want to learn more about any of their projects, scan the QR code. You've got more. And all three are welcome questions and chatting. And I look forward to doing more of this. I'm going to put in a little school plug, which is strategic priority number 5 is around creating trust in public health science and practice. And within that is the importance of centering storytelling and humanism in the science, and vice versa, centering the science in storytelling and narrative. And to me, this serves as one example of that. I look forward to so much more. I'm grateful to all of you across the community that are doing this work every day. And I look forward to our continuing to do it because the world needs it. So thank you for coming out today and look forward to more.